Welcome back to Against the Grain. My name is Dr. Samir Kakodkar. I'm a gastroenterologist and specialist in ulcerative colitis and Crohn's disease. If you haven't already, please subscribe either through the Podomatic website or through iTunes. You can find my podcast most easily in iTunes searching my first and last name. I also now have a Twitter account, which is @KakodkarSamir, or you can also just search my first and last name into Twitter. So please become a follower, and you can also email me at samir3@gmail.com. Although my training is in evidence-based medicine, or what other alternative fields referred to as allopathic medicine, I'm fascinated by other disciplines that operate on a completely different understanding of the human body and disease. There is much mystery surrounding Ayurveda in the U.S., which is the most ancient form of medicine developed in India and still practiced today. There is an inherent paradox here. How can an ancient Indian system of medicine be used to treat Crohn's and colitis, which are diseases that have only been well described relatively recently? Today I spoke with Vikram Chauhan, who is an Ayurvedic doctor who practices in India and also the founder of Planet Ayurveda. He has a particular interest in treating inflammatory bowel disease and claims to have an 80 to 90% cure rate, which I put cure in quotes, and we discussed that further in the podcast. I obviously was skeptical, so we had a detailed conversation about his protocol and experience. I did challenge some of his assertions, but overall this was a respectful exchange of ideas. We specifically discussed the cause of inflammatory bowel disease according to Ayurveda and the herbs, diet, and lifestyle modifications he recommends to treat it. As a disclaimer, I am not recommending anyone try Ayurveda for IBD at this time, since there is insufficient evidence published to show efficacy and it is not FDA approved. My literature search only turned up one case series of 43 patients with ulcerative colitis that showed some clinical efficacy with herbal preparations, but this was not placebo-controlled and mucosal healing was not used as an outcome measure, which is important nowadays. You must discuss any and all treatments you decide to use with your doctors. Today we have Dr. Vikram Chauhan, who is an Ayurvedic doctor, who I reached out to because I saw that on YouTube he had a channel with his organization called Planet Ayurveda, and he had videos, a lot of videos about ulcerative colitis in particular, with a lot of views, like over 100,000 views. So this piqued my interest because I was aware of Ayurveda, but did not know of any that really had a special interest in inflammatory bowel disease. So, Dr. Chauhan, thank you for joining us. Can you give us some background information regarding where you are and what is your training and your background?
I am an Ayurvedic doctor. I am MD in Ayurveda. I am from India. It's a city called Chandigarh, north of India. And I did my graduation, is called BAMS from Jalandhar in Punjab. And then I did my MD in herbal pharmacology from Patiala. And then I am settled in Chandigarh. I'm born and brought up in Chandigarh. I'm practicing Ayurveda from last 25 years. And I am seeing patients around 40 to 50 patients every day in my clinic. And I'm also making herbal products, and I'm exporting them to different countries. And out of 40 to 50 patients every day, I see around 10 to 15 patients of ulcerative colitis or IBD every day. So I'm getting excellent results in all such conditions.
Wow, 10 to 15 a day. That's quite a lot.
Yeah, and I'm also traveling to Europe, and I'm also seeing patients there. And I have wonderful experiences in Ayurveda and excellent results. Beyond my imagination. I couldn't imagine when I started practice that I will have so good results in such complicated disorders. So Ayurveda is a great science of India, and I'm so glad that I did my MD in that.
Great, and we do want to hear more about this. I anticipate we may have some differences of an opinion and regarding, what constitutes success and kind of your results, but I'm definitely open-minded and want to hear what your experience has been. So before we get started and get into the details of Ayurveda, I just wanted to mention I did reach out online to friends and also particularly parents from Tali Goudet's group, SCD Families, who submitted questions, which I'll ask you at the end of the podcast if that's okay with you, but some of them are included in my regular questions. I think this will be fun as they sent some very insightful, thought-provoking questions just a few days ago. So I'll keep them anonymous. I'm not going to say who asked them, obviously, but we'll get to those towards the end. So can you explain, a lot of my audience may not be familiar with Ayurveda in the first place, just that it comes from India and that it's a form of medicine there. But can you explain what Ayurveda is and how kind of you got into being interested in inflammatory bowel disease?
Ayurveda is ancient medical system of India. It is made from two words, Ayur and Veda. Ayur is life and Veda is knowledge. It is not a religion. Some people think it is some Indian religion. It is not. It is medical science. It was practiced in India. It is traditional medical system and recognized by WHO. And also we are being given formal degrees by Ayurvedic institutes. There is a proper department of Ayush in India. And Ayurveda is a way of life. It is how you live life. It is not only about how to treat only diseases. It is also to prevent diseases from occurring, to how to lead a healthy lifestyle and healthy social life, physical life, mental life, and spiritual life. So it is about complete life, not only about the physical ailments. So physical ailments is one part, and yoga is also part of it. So it is a method how you can live your life, what to eat, and how to behave in society, how to behave with your family, so that you are away from all the diseases, physical as well as mental. So it's a vast subject.
Yeah, I mean, that is, I think, one of the differences between Western medicine, or I think some people call it allopathic medicine, or this kind of system of treating people with mainly medications and surgery, right? And Ayurveda does have a portion with an emphasis of preventive medicine, but even allopathic or Western medicine has preventive aspects to it, but not such an emphasis on lifestyle and diet, even though we kind of pretend, but a lot of physicians in reality don't give a lot of good advice about diet, but it's mainly with like screening for cancers and different testing and trying to prevent cancers by catching them early, etc. But in Ayurveda, it's kind of a different approach of dealing with lifestyle, right? And seeing if you can get the optimal lifestyle to prevent disease.
Yes. It is okay to have screening also because we are living in 21st century. But I wish if it is better if we incorporate Ayurveda into the modern medicine and learn from Ayurveda, because our ancients, they have worked so hard and found some methods, the way we can treat different diseases and way we can prevent different diseases. So if the modern medicine incorporates principles of Ayurveda living and Ayurveda way of healing, it will be wonderful for humanity, for everybody.
I agree. Yeah, I think there are definitely valuable parts of it, and hopefully we can get into some of those. So how did you develop this particular interest in ulcerative colitis treatment? Was it because just you had patients, just so many showing up to you, and you kind of came up with protocols for it?
When I started my practice 22 years ago, I was getting all kind of patients. I did my BAMS and I was getting all kind of patients. And it is not only about ulcerative colitis, it is about so many other diseases. I'm getting results in asthma, I'm getting results in rheumatoid arthritis, in other autoimmune disorders, cancers, and so on. So slowly, when people were getting healed, I was using Ayurvedic protocols, and the word of mouth spread, and the people started coming in. Recently, from last 4 or 5 years, I'm getting very good results in ITP also. There is a disease, another autoimmune disease, idiopathic thrombocytopenic purpura. So I am surprised to see the results. I never imagined that it can be cured. So there are certain principles in Ayurveda which we can follow to cure autoimmune disorders. There are so many of them. So slowly, when people were coming to me suffering from ulcerative colitis or IBD, and they got very good results. I gave basic things, basic herbs which I'm using, which are recommended for this kind of disorders. And I got results, and slowly, I got popular. I mean, I put them on YouTube, I put them everywhere, and people, they started getting to me.
Okay. So it was kind of just seeing the results, and it seems like you have had particularly impressive results from your perspective for ulcerative colitis. What about Crohn's disease? Do you kind of treat them as the same thing, or do you differentiate those two?
No, it's the same way. The principles are the same. Yeah. So basically, we treat the patient analyzing the Vata, Pitta, and Kapha doshas. And it is very important to understand what is Vata, Pitta, and Kapha. According to Ayurveda, the whole world is made up of 5 elements: earth, water, fire, air, and space. That is Panch Mahabhuta. The concept is our universe is made up of 5 elements. And 5 elements plus soul, that makes us human. And 5 elements, they are represented in our body as Vata, Pitta, and Kapha. The earth and water makes Kapha, fire makes Pitta, and air and space makes Vata. So when the balance of Vata, Pitta, Kapha is disturbed, then there are diseases. So we just restore the balance using the herbs, using the Panchakarma, using the massages, using the counseling, using the herbo-mineral preparations. So all such things are used to restore the balance of Vata, Pitta, Kapha. And every individual is different. According to Ayurveda, every person has his own prakriti, or the individual attribute or individual characteristics or individual nature. So this prakriti concept is very important in Ayurveda. So one person may feel good with one thing, other person may feel bad with the same thing. So why it is so? Because every individual is different. So we check the prakriti of the person, because even every person can have different constitution of these 5 elements in his body. So physical matter is defined by 5 elements. The spiritual matter is defined by soul. So our body is made up of 5 elements plus soul. So when we see the imbalance of 5 elements and the prakriti, the natural inborn characteristic of the person or the nature of the person, that is called prakriti. And the protocol changes according to the prakriti.
Okay. That's certainly something I've observed that kind of goes along with that, in that patients with inflammatory bowel disease, a particular medicine or intervention or diet can help one person, but if you use that same combination of things in a different person with presumably the same disease, it may not work. So it's interesting to hear kind of the Ayurvedic perspective of that.
Yeah, there is a concept of Vikriti also. Vikriti means imbalance. Prakriti means nature of the person. Vikriti means the disease or the current imbalance. So if the modern medical system is working only on the Vikriti, what is the current imbalance or what is the current disease? And similarly, if we give something for Vikriti, then it can be similar for all the diseases, symptomatic treatment. One is symptomatic, one is restoring the balance, what is focusing for the cure, and one is focusing for the symptomatic relief. So there are 2 ways, symptomatic relief and balancing the cure, balancing the elements and finding the cure, focusing on the cure.
No, I mean, what we mean by cure is also a little bit controversial, but you're right in that the medications we use for inflammatory bowel disease are not curing anything, but for many people can sustain a clinical remission or a clinical response for long periods of time. But you're right in that it's not reversing any disease process.
By cure, I mean when the patient was diagnosed as IBD or as Crohn disease or as ulcerative colitis. At the first place, he was diagnosed and labeled as ulcerative colitis, confirmed by biopsy. And then the patient was given all these allopathic medicines like Asacol and steroids and all the Humira and all these immunosuppressants. And once they start Ayurvedic medicines, and slowly, the patient is off allopathic medicine. He is not taking any allopathic medicine. Then slowly, he is not taking any Ayurvedic medicines. And then after that, he is confirmed by colonoscopy or biopsy that he is no more having this problem. So that is what I call cure. So this is what is the experience about IBD and ulcerative colitis. So that is why I call it cure. And that is possible. I have seen cases that is possible in Ayurveda. And patient is symptom-free. No problems. Yeah.
Okay. Yeah. I mean, that sound, I mean, to me, cure would be, like not having any really symptoms, not having symptoms anymore, having a colonoscopy that's normal with normal biopsies, and also not really doing anything, I guess, medication, supplement-wise to sustain that. Diet is a little bit controversial because sometimes people drastically change their diet and they feel better and they get better. Is that cure or not? Because they have to stay on that diet potentially. I would still consider that potentially a cure, unless if they have a deviation from that diet and they have a flare, then it's maybe just maintaining remission with diet. But even then, I mean, still in my branch of medicine, when we heal the colon with medications, and we sometimes stop the medications, there are a certain percentage of people where the disease doesn't come back. So are we in allopathic or Western medicine calling that a cure? No, we call that more of just like a sustained remission. There is still a risk of it coming back later on. That's certainly possible, but particularly with biologics and when we heal the colon and we get normal histology on biopsies and we stop the medicine, there is a percentage of people where at least in like 1, 2, 3 years down after doing that the disease doesn't manifest and they stay well. And there's certain parameters that we check where it's more likely to be the case. Again, if they have a completely healed colon, if they've had not a complicated disease course before stopping medication, if when we stop the medicine, their drug levels are absent or it doesn't look like it's doing anything, then it may be someone who is at a better odds at sustaining remission without any medical therapy. So the definition of cure is kind of it's tough. There's this old saying that goes back many years about inflammatory bowel disease that it kind of goes once colitis, always colitis, meaning it never goes away. And that's really what has been the traditional teaching. But again, with better treatments that we have, and it seems like you're having success too, it's possible to have sustained remissions.
Yeah, I would interfere that old saying is not so old. That may be 100 or 200 years old. Mm-hmm. And as the advent of allopathic medicine, that old saying that once a colitis is always a colitis is maybe old for like 200-300 years old. But we are talking about 5,000-year-old science. So in that science, it is called. It is not described as IBD or as ulcerative colitis. It is described as something in Sanskrit. In Ayurveda, this IBD, these kind of disorders, they are described as Amajanya Rakta Pitta Tisar. So we are defining certain things in Ayurvedic way, and we are treating those disorders. And those disorders, and they have similar symptoms like ulcerative colitis and IBD. So we are treating Amajanya Pitta Rakta Tisara, so which is having a similar list of symptoms like ulcerative colitis and IBD. Weight loss is there, bloody stools are there, and this mucus is there, pain and cramps and discomfort is there. So certain this same disorder is described in Ayurveda as Rakta Tisar and Pitta Tisar. Mm-hmm. And we are treating, and ama, formation of ama is there, formation of the toxins is there, the fermentation of food is going on, the patient is not able to digest the food properly, and certain these symptoms, they are described in such diseases, and we are treating those diseases, and we are curing those diseases, and according to modern parameters, they can be verified and checked. So this is how we are saying that we are treating only Pitta Tisara or Amma Tisara.
Yeah, I mean, I'm glad you brought that up, because one of my questions was that, these terms, Crohn's and ulcerative colitis, were thought to mainly affect westernized countries, but now it's more worldwide. It's a little bit unclear because in India, the thought was that maybe some Crohn's diagnoses were misdiagnosed as tuberculous enteritis before it was well recognized to be more of a global phenomenon, which it is now. I mean, pretty much inflammatory bowel disease is worldwide now. I mean, it used to be really just being detected in Europe, Canada, U.S., but now it's everywhere. So that was my question. I'm glad you answered it, because I was wondering how Ayurveda would have a prescription for a disease that's relatively newer onset. I mean, maybe in the last couple hundred years, really it's been more well described. But so that answers my question. It seems like this entity that you described with similar symptoms is kind of what you're drawing from when you're coming up with the prescription for it. But I wonder if what they were describing back then, like thousands of years ago, was more an infection, like an infectious type of colitis or something that we would more expect in the ancient world, rather than these diseases which we think are more of diseases of civilization, of good inordinate hygiene, maybe a family history, maybe associated with genetics. So those things that may not have played a part back thousands of years ago when Ayurveda was developed.
No, all these diseases which are there in modern days, they were explained and defined in ancient manuscripts. They are already explained with the symptoms, with all the theory and the pathogenesis, as well as the treatment. So it's a huge science, as I was saying. So people should read it. In Ayurveda, Vata, Pitta, Kapha also have 5 subdoshas, 5 Vata, 5 type of Pitta, 5 type of Kapha, and then there are certain tissues. There are proper pathogenesis involved. There is proper pathogenesis involved, and that is also explained. These diseases are called of group of diseases. IBDs is called Sangrani. IBS and IBDs are considered as part of the disease group of diseases called Sangrani. There are different types of Sangrani explained in Ayurveda, and those symptoms, and Atisar, Sangrani and Atisar. Atisar means diarrhea, and when the Atisar becomes bloody, it is called Pitta Atisar and Rakta Atisar. And such certain terminologies are given in ancient Ayurvedic books, and where we can correlate the symptoms of those diseases with the present modern day, because we have in Ayurveda current curriculum of BAMS and MD. When we studied allopathic also, allopathic texts also, like Davidson and Huntington's methods of clinical diagnosis, and all such books we read. And when we can correlate those ancient books with the modern books, and we can find, okay, in modern medicine we have these kind of treatments option available, and in ancient books for the similar disease we have this option available, and that option when we try, we see different results, and this is really amazing. So that's why I said in the beginning that all the modern doctors who are like you, who are highly intelligent doctors, most intelligent people of the earth, they are studying the modern science. And if they put their brain in this ancient science also, they will find that there is a whole lot of already hard work done, already research is done. Just you have to search it, you have to decode it, you have to understand it. We are doing the courses. It is ironic that many Ayurvedic doctors, they are just doing the 5-year course, and after that they start practicing allopathic in India. If they are studying allopathic, I studied allopathic also while I was doing BMS, because it is there in the syllabus. Okay. And then I compared the old science with the new science, and I found that there are answers in the old science, and in the new science, of course, there are answers. And I am not against allopathic. There are so many diseases which are solved by modern medicines. But we have answers in ancient medicine also. So we should find out. We should add the missing chapters into allopathic system. That will be great. And I am glad that you are open-minded person. You have a open mind, and you have come up to understand that Ayurveda can also help in these modern diseases. These diseases, which are not modern at all. They are
Yeah,
ancient.
I am open-minded, and I'm so glad you've come on, because I think there is a problem with conventional doctors, MDs trained in the kind of the Western way, and that we're very, not myself, but I think a lot of people can be arrogant and dismissive of other philosophies, and we tend to get narrow-minded and think our way of doing things is the only right way. Because it's, presumably more evidence-based. But I'm open-minded. I want to hear from people. Like, if there's people out there who think they have a solution to it, why not? Why not? I want to listen. I at least want to listen, and I want that voice to be heard. And then people can come to their own conclusions, including myself, regarding if it's valid or not. So let's.
You are absolutely right. You are absolutely right. And in my opinion, I don't want that allopathic doctors should blindly follow Ayurveda. They can do the check. They can verify the knowledge. The knowledge is there. They can verify as per their own clinical parameter. They can do clinical trials. Everything is available. They have mentioned group of drugs, group of herbs.
Right.
Group of herbs which are useful in this condition, group of herbs which are useful in this condition. So you do clinical trials. Ayurvedic doctors, they are not trained in a way to do clinical trials. I am in the field of Ayurveda. In MD, there are very few doctors who do MD after doing BMS, after doing graduation. Little people, very small number of Ayurvedic practitioners, Ayurvedic doctors, they do MD. In MD, we are informed about the research and how to do the research. But again, very few of them, they go for the research. But in a modern system, everybody is trained how to do clinical trials. So if the people from modern system, they verify the Ayurvedic system and they do their clinical trials, they do the research. I'm not saying just follow blindly. If somebody is saying this is healing, you can verify.
Sure.
This is modern. It's easy. So I'm sure this will be a great step for everybody.
Yeah, that's refreshing to hear from yourself, that you're willing to, as far as your protocols, put them to the test and put them in clinical trials. And really, that's really the only way to convince conventional doctors that something works.
Yeah, I remember one more instance when somebody from Harvard Medical School in USA, he approached me. There was a team of doctors. They approached me in Chandigarh, and they said, "You are doing so well in ulcerative colitis. You should do some research, clinical research."
Mm-hmm.
I clearly said, I am a practitioner. Actually, I am a practitioner. I'm a physician. I am seeing patients from morning till evening, and I am giving them the herbs according to Ayurvedic principles. And it is out of my scope. I don't have so much time to give on research and do so many things. I am doing it, whatever possible I can do. But I need assistance or some help, physical help, not monetary help, at least physical help. You find somebody to take the samples or whatever things you want to do, and appoint somebody who can do this research work. I am willing to give you my patient. You can verify whatever you want to do. I will just keep working as I am. So, but these things, they couldn't materialize because they were in Boston and I am in Chandigarh.
Sure.
But it is my open invitation to doctors all over the world. Whosoever wants to do clinical study, modern doctors who are into research, and I don't have any desire to do some patents or some take monetary benefits. I have desire that if I'm doing something, it is not which I am doing, it is already there in Ayurveda. They can just check it and they can verify, they can do clinical trials. I have patients, so they can publish it under their name. It doesn't matter. So this is how we should approach to get rid of not only this IBD or ulcerative colitis, but also many other diseases. They are already there in Ayurveda, very well explained.
Okay, well, let's get down to the meat of it now. So first, I want to talk about the cause. According to Ayurveda, what is the cause of Crohn's disease and ulcerative colitis? You spoke about the doshas and the imbalance, but zooming out from that, like, what is causing this imbalance? What is ultimately the driving force behind these diseases, and why are we seeing so much more of it now?
Yes, this is the last sentence. I liked it. Why we are seeing it more of it now? Because according to Ayurveda, the doshas are affected by our diet and our lifestyle and the seasons. And the modern day diet has changed a lot. The diet, according to Ayurveda, it is amajanya pitta tisar. I will explain what is ama. Ama is when we, our abdomen is like a cask, like a barrel. When you make wine or when you make alcohol, you put you put some sour, something vinegar, some grapes, and then their fermentation starts. Similarly, in our abdomen, when we put some non-vegetarian food, when we put some yogurt, when we put some buttermilk, we put some salads, we food, and all this, when alcohol and everything, and tea and coffee. So everything mixes up in the barrel, and this start making sound like fermentation is happening. Because the modern day diet has become so artificial, children are eating chips, they are eating this, drinking this soda drinks. Soda drinks are full of carbon dioxide, and we are struggling to get rid of carbon dioxide from our body. But people are drinking carbon dioxide in the form of these soft drinks. So these kind of eating habits, they have effects like they form toxins in our digestive system called ama. That ama is called endotoxins. When the endotoxins are formed, they trigger this autoimmune reaction. They are the birthplace of some antigen formations, and those antigens they form kind of these antibodies, and there is antigen antibody reaction. That's why it is called autoimmune disorder. And they also damage the internal lining of intestines. So this ama is there, and then there is a other continuous consumption of pitta aggravating food. Pitta aggravating food is too many spices, too much heating substances, like I said, carbon dioxide, and too much dead food consumption, chips and flakes, which are dead food according to me. Dead food, when you see some food in under the microscope, when you don't see any life in that is dead food. Animals, are you there, Dr. Samir?
Yeah. I'm giving you the floor, so I'm listening very carefully.
Animals out there in the forest, the animals they consume live food. They consume fruits, they consume vegetables, they consume grass, they consume other animals, they consume alive food. Humans, they are consuming dead food. The food which our food, we are animals basically. The food which is coming out of the earth, that is live food. The fruits, the vegetables, and we take the food from the earth into the factory, and from the factory we bring biscuits, we bring noodles, we bring certain chips, and we bring soda. Our drink is water, but what we drink? We drink soda, we drink alcohol. So these kind of problems, that's why so many diseases they are coming up. And of course, there is genetic component to it, as you mentioned. In Ayurveda also it is mentioned that there are genetic disorders. So that similar things are mentioned in Ayurveda. So we have to take care of those things also into account. Genetic things are there, environmental things are there, and the imbalances of dosha is there. And this all aggravates this ama formation in the digestive system that leads to autoimmune disorders. And then and also the pitta, when we increase the pitta dosha or the fire element, when we consume a lot of fiery things like spices and carbon dioxide, and that leads to pitta imbalance, and that leads to inflammation. Pitta means inflammation. Pitta means growth. Pitta means growth. Pitta, what is pitta? Pitta is fire. Fire in the universe. Like fire, what fire is doing in the universe. For example, if we look at the sun, what is the role of the sun in the universe? The sun is providing life. It is causing metabolic changes. It is causing the seed to grow. We put the seed in the earth, and we put the water, and we need fire. We need transformation, one form of energy into another form of energy. that is done by fire. Similarly, we have metabolic fire in our body that is converting our food into different molecules which our cells they use it. We are made up of cells, and we are made. Well, the cells they are made by our body, by our fire, from the food. So how the cells will be found when we eat dead food, which is not full of natural. In modern medical system, we have found certain amino acids. For example, 24 amino acids. For example, 8 amino acids. For example, we have found vitamins. For example, vitamin A, B, C, D, E, K. So we have found some vitamins today. But if you go 100 years before, there you find so many vitamins. We found few. If we go 200 years before, so you will see we found only few vitamins. And if you go 100 years after, then you may find another vitamin. Oh, this vitamin L is there. This vitamin N is there. This vitamin O is there. So this vitamin O is responsible. It is found in apple. Vitamin O is found in this, and this is responsible for this, and this. And then we will understand, oh, vitamin O is useful for this condition. So this vitamin theory or this elemental theory that this thing is responsible for this enzymatic theory. These are theories which came up only a few years ago, 100 or 200 years ago. But this ancient science says you just consume apple. Apple has certain elements, vata, pitta, kapha. Or if you take yogurt, or if you take banana, if you take live food, it affects your doshas, vata, pitta, and kapha, and it can restore the balance. That is holistic approach. That's why we focus on holistic approach this way. So as I was explaining what is the cause. So ama is formed in the digestive system. Pitta is imbalanced. That causes inflammation in these loops, intestinal loops. Can be small intestine, can be gastrum, can be stomach, can be duodenum, can be colon. So
okay. So that's the diet aspect of it. What about lifestyle? Are there things about the modern lifestyle, both in India and worldwide, that are leading to these imbalances as well?
Yes, of course. According to Ayurveda, vata imbalance is the root cause of so many diseases. And place of vata is colon. Main place of vata in body is colon, according to Ayurveda, and vata element. And this stress is the leading cause of imbalance of vata, according to Ayurveda. Whenever there is manorog or manasik shok, whenever there is fear, whenever there is stress, anxiety, phobia, and all such apprehensions, these lead to imbalance of vata. And that can be correlated with modern medicine also, because when we are disturbed mentally, our hormones they went through catastrophe. Our adrenaline is high, our cortisol is high, and those lead to so many diseases. And even we can, when you are in a state of fear, immediately you get diarrhea. Whenever you are thinking something fearful, the vata gets imbalanced. According to Ayurveda, we can correlate vata with adrenaline also, with certain neurotransmitter. We can correlate with that. If you study Ayurveda from comparative study of Ayurveda with modern medicine, we can compare vata with certain neurotransmitters. And because vata is responsible for movement and for neurological systems. So it is very much associated. Gut is associated with brain. As you know, so many neurotransmitters are there in the gut also. So vata is seat of colon is the seat of vata as per Ayurveda. In ancient books, it is mentioned that vata is residing in colon. So whenever we are disturbed mentally, whenever we are living in some fear or thinking of future or a stressful situation, it affects our mind and our hormones, they get disturbed, and immediately we get so many diseases. Our hormonal we get palpitation, adrenaline is there, the respiration increases. So certain things happen in our body as soon as we are in the state of fear. For example, if you see a lion in front of you, a lion comes, what happens? Immediately, your body will be secreting adrenaline, and it's a stress response. You know it. So that can be correlated with vata. And according to Ayurveda, this has a lot of to do with the stress.
Okay.
So nowadays, everybody is living in fear. Everybody is living in stressful situations.
Sure. I mean, anecdotally, I know many patients who've said they've been at least diagnosed during particularly stressful times in their life. So that makes sense. But, according to our research in, Western medicine, there hasn't been a consistent correlation, but there's problems with how those studies were done and as far as outcome measures. So at this point, it's unclear if stress is a trigger, a cause, a potential contributor, but it certainly makes sense to me.
According to Ayurveda, it is a cause.
Okay.
Because vata is imbalanced and vata is present in pitta and kapha. They don't do so many problems because there is a Sanskrit verse, pitta pangu, kapha pangu, pangu mal datva, vayuna yatra nyante tatra gachanti megvat. The translation is pitta is handicapped, kapha is handicapped. They don't move. And wherever vata takes them, they start moving and go, and then they cause problems, they cause diseases. So vata is the main moving force behind them. If vata has straight link with the brain and with the mind. So if something stressful happens, immediately vata is disturbed, and immediately the hormones are disturbed. People get thyroid problem because of stress. People get this so many diseases. Diabetes they get because of diabetes levels are not controlled because of stress. There are so many diseases which are related with stress.
Sure.
They are aggravated with stress.
Yeah, I mean, their thyroid disease is connected with, at least associated with, both Crohn's and ulcerative colitis, both hyperthyroidism and hypothyroidism. So at least there is a corollary there.
Only one hormone is affected by fear or by mental fearful situations. Not only one, thyroid, but also all the other like even diabetes also. You can imagine that people, they are not able to control their sugar levels when they are in stressful situation. So why it is? Because the body is secreting more cortisol, and according to Ayurveda, that is imbalance of vata. All the hormones, they are correlated with vata. So when we are treating somebody with hormonal imbalances according to modern medicine, we are just focusing on particular organ. Oh, thyroid is wrong, then we give thyroxine. Or diabetes, this sugar level is not controlled, then we give insulin. So this is testosterone levels are low, or menstrual flow is not proper, then we give female hormones or the testosterone. But if we think according to Ayurveda, we see all the hormonal system, endocrine system as one system. And we reduce the vata, we alleviate the fear, we calm down the vata, we give enemas, oleation therapy, we give Shirodhara, and then when we calm down, we give Brahmi to calm down the mind, and then we see good response in all hormonal imbalances, all diseases. I have seen patients of thyroid, of diabetes, of infertility. Everybody responds very quickly to Brahmi when I treat the mind.
Okay.
This is one body, one function, one system.
And you mentioned fear, and I have seen in your, and next I promised the listeners that we're going to get to your actual protocol, but I have one more question before we get to that. In some of your videos, you talked about after you get an initial colonoscopy and diagnose yourself with inflammatory bowel disease, even that you don't. It seemed like you're against colonoscopy, against kind of these diagnostic things, because they may introduce fear into the picture and make things worse. Is that a correct characterization?
No. I am not against colonoscopy at all. I always advise patients that problem is that sometimes modern doctors, they don't explain really well. Maybe in USA they explain very well, but in India the patient goes to the doctor in fear and they just do the colonoscopy. They don't explain what is the procedure, why it is done, what is the benefit. So I explain the benefit of colonoscopy to all my patients. I tell them always go for colonoscopy. I always tell them. I tell them you should go for colonoscopy. Colonoscopy is just a scope. It will just have a camera in front and it will just take picture of your colon. And then you will have your pictures, like you have picture of your face, you have picture of your colon inside. And then you can just see that you are healed or not healed. And don't go for biopsy again and again. This is what I say. What happens here in India, whenever they go for colonoscopy, the doctors, they take samples, 3-4 samples, not only one, from 3-4 different places. And then that causes a lot of pain, that induces a lot of trauma to the patient, that doing biopsy every 6 months or every 1 year, I don't think that leads to anything. We are going to detect cancer. The cancer doesn't happen after every 6 months. We can just clinically see it if it is happening or no. But again and again doing biopsies, that leads to a lot of flares and a lot of problems to the patient. So biopsies can be avoided as long as possible. One biopsy you have done already in the beginning, that is okay. I recommend that. When we are going to diagnose the disease, you do the colonoscopy, do the biopsy. Okay. And after 1 year or 6 months, you can do colonoscopy again, but not need of biopsy. The patient is new, he's not chronic, he's just having 1 year of ulcerative colitis. Then what is the need of biopsy again and again? But here in India, the biopsies, they induce a lot of problems.
So I understand where you're. Sorry, I understand where you're coming with from that. Just to mention my perspective on it, I disagree with that statement. But the reason I say that is biopsies usually don't cause pain. If a patient has pain after a colonoscopy, it's usually not due to the biopsies. The biopsies are just mucosal, and there really isn't any nerve innervation of the mucosa, so it usually doesn't cause any pain. And these biopsy sites heal over the course of, like a couple days most of the time. Even when we take polyps out, the polypectomy sites heal pretty quickly after we take them out. As far as the need for biopsies past diagnosis, usually the recommendation is if you have ulcerative colitis or Crohn's disease that involves more than a third of the colon, as far as ulcerative colitis more than just the rectum, you're supposed to get a colonoscopy every 1 to 2 years after you've had the disease more than 8 years. And we do biopsies, and the reason for this is colon cancer surveillance. If we detect any kind of precancerous lesions or cancer, we can remove them if they're visible, and if they're not visible, if they're invisible dysplasia, we have to talk about having the colon removed. And this is potentially a life-saving thing, because if we just wait for cancer to be symptomatic, it may be too advanced for us to actually treat it effectively. And I know you may disagree with that approach. That's fine. We can agree to disagree, but that's just my perspective.
No, that is okay. I can also agree, because I am not saying don't do biopsy, but I am saying just don't do it repeatedly every 6 months or so. It can be delayed, or maybe if you counsel the patient, at least guide the patient, try to alleviate the fear. Because to me, the patient, they complain that whenever they did biopsy, they didn't even tell us, and they just they asked us to just go for, we will take only colonoscopy, and we were not interested in biopsy, and they did. After the biopsy, I had more bleeding. So the patient is saying, after the biopsy, I had a lot of bleeding. After that, this started again, because maybe it is not because of biopsy, and maybe it is because of the fear. But at least the patient is now again suffering because of the fear. If you alleviate the fear by doing, you can do biopsy, it's not a problem, but at least guide the patient. It is not going to harm, it is not going to pain, it is not submucosal. It is very easy.
I agree with you. There is a lot of fear that's induced by seeing physicians, particularly more on my side than yours, because you do a colonoscopy and we do a biopsy, we may diagnose someone with the disease, and we call it this Crohn's disease or ulcerative colitis or whatever you want to label it. And then that does induce quite a bit of fear in people, because if you just do a simple Google search of what Crohn's disease is, you're going to get terrified, even though, and you're going to assume the worst is going to happen to you, even though 10 to 20% of patients with Crohn's disease have a very non-progressive course that is probably not going to progress to require surgery. In our literature, however, 80% do have a complicated course and require surgery over time, and that can very much scare people. So I get it. Even just being labeled with these diagnoses, it can really mess with your mind. And I do believe the mindset is very important regarding the success of any treatment. You kind of have to be on board and have to have an optimistic outlook for it for things to work. I really believe that.
In Ayurveda, in my clinic, I see more than 80% positive response, more than 90%, I would say. So 90% of the patient, they are saying we are healed, we are living without medicines, without Ayurvedic. I stop Ayurvedic also, I stop allopathic also, and they are happy. And I have patients who are happy from last symptom-free, from last 5 years, 7 years, 10 years. There are so many patients, they have never complained of any symptoms. I just tell them not to consume milk, not to consume cheese, and butter.
Wait. Let's go from the beginning. What is the protocol? Let's get to the protocol now. Now, as far as if you see a patient in your clinic who has this condition, what is your recommendation?
According to Ayurveda, I see the Prakriti, but I give the basic things which are good for everybody. It can be Pitta person, it can be Kapha person, it can be Vata. It can affect all type of people. It is not about that certain one type of people will get, but usually Pitta type of people, they complain more about this because they are prone to such acidic disorders or the Pitta disorders. And the protocol is to calm down the Pitta, to stop the fermentation of the food in the intestine, to heal the ulcers. And I use certain herbs which are good for reducing the pitta, to reduce the diarrhea. There is a herb called Kutaj. Kutaj is Halorina antidecentrica. The Latin name is antidecentrica. I don't know how they named it, but it is named by botanists. So it was described in ancient literature in Ayurveda as Kutaj. Kutaj is good for all kind of diarrhea, dysentery, and infections, all kind of gastrointestinal infection. Even even somebody suffering from dysentery or diarrhea, ordinary amoebiasis, we give Kutaj and he is healed. And so Kutaj is one herb which I am using. In the extract of that Kutaj I am using 2 grams 3 times a day. I am asking the patient to take it. And the diarrheas, they stop immediately within 3-4 days. Most of the patients, they say, some patients they can take 15 days, 1 month, but mostly they say 1 month, within 10 days, 15 days, they are better. The episodes of diarrhea, they are lesser. And accordingly,
does that just help just diarrhea, or what about blood in the stool, like bloody diarrhea? Does the blood go away, or is it just the loose stool?
Just the loose stools, they go away.
Okay.
And it is all. And then I use Arjuna. Arjuna is another herb. The Latin name is Terminalia arjuna. Usually it is mentioned in Ayurveda for heart problems, for blood pressure, because it is rich in coenzyme Q10, natural CoQ10, and it is good it has natural cardiac glycosides also, arginatinoids they are called. And these modern scientists, they have discovered these alkaloids in these herbs because they worked on these herbs. But according to Ayurveda, it is working on heart. It is working on healing the wounds. So according to Ayurveda, this Arjuna is healing the ulcers.
Okay.
Whenever there are wounds, it is called Vrana Ropak. Vrana Ropak means wound healer in Sanskrit. So it is healing the wounds. So I am giving Arjuna extract 2 grams morning, evening, or 1 gram morning and evening. For about 6 months, I am using Arjuna. And similarly, there are so many herbs like I am also using this combination of coral calciums, which are found in the seabed. There are certain Ayurvedic preparations made from those which are very cooling in nature, balancing the pitta dosha. I have named it as pitta balance.
Okay.
And to balance the pitta, I am using these herbs, and patient feels that his heat is gone, his body is better. I mean, he starts to gain weight. The blood stops, and there are certain herbs, more herbs also, which I'm using. I have made a syrup called clotoplan. That clotoplan is having, marigold flower.
Okay.
But they are very good astringent, and they stop bleeding immediately. I ask my patient who are not near me, I tell them just drink marigold leaf juice. Just not. I don't recommend too many juices because raw fruits and raw salads I don't recommend in ulcerative colitis or IBD because they can increase the diarrhea, they can increase vata because they are very light. The properties of vata is lagu rukshital vishad khar, light and light and dry and minute. So anything which is too much light is not good for vata. For example, these salads, raw salads and juices. So only small quantity of pomegranate juice, 50 ml every day, 2 times a day is okay. So that is astringent. Pomegranate is very much astringent. This marigold leaves juice is astringent and healing. This Mimosa pudica is a herb. Lajwanti it is called. When you touch me not plant, when you touch it, it shrinks. So that is also very good astringent and stops bleeding and heals the wounds.
Okay.
So I'm using the juice of that, extract of that in that cloto plant to to heal the wounds.
Okay.
I have named it plant, but it is healing. And there is Dalbergia sisu. The Latin name is Dalbergia sisu. Shisham. Shisham is a cooling tree. The leaves of that shisham, they are very cooling in nature, and they also heal the wounds. And Lodra is there. Priyangu, there is another herb, Priyangu, mentioned in ancient texts. All these herbs which I am mentioning, they are mentioned in ancient texts as wound healers as well as stopping to enhance the clotting or stop the bleeding from. Whenever there were cuts and wounds in ancient times, they used to rub the powder of these herbs on the wounds. The bleeding would stop. So similarly, immediately I see results. The patient says my bleeding is stopped and the diarrhea episodes, they are gone and they are better. And we are giving wound healers also. So slowly, and natural antioxidants are there. So this is how I am. I was talking about pomegranate juice and no raw salads and no raw, not much. Only the fruit and also sour fruits. I won't recommend sour fruits like oranges and the citrus juices, citrus fruits. People they consume citrus fruits or citrus juices. That is also causing an imbalance of pitta sometimes.
Okay.
So spicy food, I ask them to avoid spicy food.
Okay. So you talked about the herbs and some dietary recommendations, but overall, in what else about the diet? Because I know I've listened to some of your videos, Bart. It seems like you have a set of foods you recommend people start with, and then from there they expand, right?
Yeah. This rice gruel is very good, light. This khichdi, we call it khichdi in Ayurveda. Khichdi, it is very light in digestion, to digest, easy to digest. But khichdi I recommend. It is made from rice and moong dal. There is some pulse, yellow moong dal, that is very light in nature, and that also doesn't cause vata imbalance. So we have to take care of vata and pitta. Basically, vata pitta is the main culprit in ulcerative colitis and IBD. So just calm down the pitta. And ghee is very good. I don't recommend milk. I don't recommend this butter, but I recommend ghee. Ghee is good for pitta. It improves digestion. It improves weight, and it heals the wounds. Heals the ulcer. In old times, they would put honey and ghee over the wounds. It would heal. So with some neem and something like that, some curcumin, some turmeric. So ghee I would recommend. It helps to give nutrition to the patient. All the fat soluble vitamins, they are absorbed. And the coriander leaves, they are also very, very cooling. All the animals, as I told you, they consume leaves for their calcium, for the iron source. So we should also consume some coriander leaves, which are cooling in nature, so which are reducing the. So I recommend juice of coriander leaves, fresh coriander leaves, or celery leaves you can use in America. Only two teaspoonfuls twice daily, not 1 glass or 2 glass. Only 20 ml, 10 ml is enough, because too much of juicing can cause vata imbalance. So juice, I won't recommend any kind of juice. Only pomegranate juice, 50 ml, I'm recommending, because it can cause, it is astringent. So yogurt, thick yogurt, I'm recommending. In Ayurveda, takra is recommended. Takra is a preparation when you just churn the thick yogurt with water and take out the butter from it. There are so many people, they don't know how to make takra. They just make lassi or chach or just buttermilk, and that is in the name of probiotics they are consuming it. But that can cause problems, because the properties of vata, pitta, kapha, they changes after the process. So takra is prepared when you just add 50% of water in thick yogurt, and then you churn it, and then you make the butter and take out the butter off from it, and then the left behind watery type of thing is takra, and
So-
you can is takra.
So as what you're terming butter, or do you mean like kind of like the milk solids you remove? Is that what you mean?
Yeah, that is butter is milk solids.
Okay.
So you remove all milk solids, and then you are left behind with only some watery thing.
Sure.
That is for improving the digestion, for restoring the gut flora, and for improving the appetite.
Okay.
And also, so this is what I'm using. And you can add some cumin powder, cumin seed powder. You can just roast some cumin seeds, and you can add those roasted cumin seeds in the takra, and that will improve the appetite and also restore the gut flora. You can also add some coriander leaves in that, just crushed coriander leaves.
Okay.
So that's also good. And you can asafoetida, very little quantity of asafoetida can be added to reduce the vata.
Okay.
So asafoetida can be. Takra is used. I am using thick yogurt. I am asking my patient to consume thick yogurt every day, 1 or 2 times or 3 times, because thick yogurt, according to Ayurveda, is abhishandi, or it stops the bleeding and it heals the wounds. It can stop the diarrhea. So I'm
and
asking.
is it okay to buy this from a store, or do you have to make this homemade? You can buy
Yeah, it is
yogurt from the
okay.
store?
Not flavored, not too much fancy, but only the basic plain yogurt is good. Thick yogurt with banana. If you can take with banana, you can take it separately. And bananas I would recommend, because banana, they are also giving a lot of nutrition and vitamins, and also make a paste over the wounds and help the body to heal it.
So does it matter if the bananas are ripe or green bananas? Like, is that in some other diets, including the specific carbohydrate diet that's used for IBD, they specify the bananas have to be ripe, meaning yellow with spots on it. Does it matter to you, or can people have green bananas or plantains or?
Ripe banana is better, because they are easily digested.
Okay.
Right. Good. And to gain weight, this rice gruel khichdi, what we call, with the ghee, is very good.
Okay.
And grain, so like for example, this wheat chapati or this corn chapati can be consumed if you are able to digest it. Little bit of it.
Okay.
One chapati per day can be consumed with the soupy dal. Dal is pulses, especially moong. Moong dal is what I recommend. Every day, moong dal can be consumed. And soaked almond can be consumed. 5 to 6 soaked almond. You can just crush them, make powder, and take with banana, soaked almond.
So these foods you've just described, and according to your video, I wrote down kind of what you said. You in your YouTube video, you mentioned curd, banana, khichdi or rice gruel, green lentils or moong dal, boiled potatoes, pomegranate juice, and then you just mentioned a few other things. Are you saying people just have to only eat those foods when they're, like, let's say, very symptomatic or first diagnosed, and they should only stick to those? And, like, what time period are you talking about before they can, expand from that?
They should take all these when they are symptomatic, like they are having bloody diarrhea and lot of stools, like 10 times, 5 times,
Okay.
15 times. They can use this dietary protocol for about 15 days, 20 days, 1 month or 2 months. After that, slowly they can add everything, but accept one thing for life. Milk is main culprit. Milk they should avoid.
Okay.
Milk and butter and cheese. These three things I avoid them. I tell them to avoid forever.
Milk, butter, and cheese.
Milk, butter, and cheese. Everything else they can consume. Everything else. And some of my patients, they also started consuming alcohol, which is not wise, which I won't recommend. I had a army colonel. He had this ulcerative colitis, and after getting healed, after 1 year, I got a call from his wife. Dr. Vikram, you have healed him. Now he's drinking alcohol also.
Yeah, I guess he's celebrating, right? He must be real happy that his symptoms have gotten better. So, but he treated for another problem.
So, but I won't recommend that.
Right.
Another guy I met, he started eating everything, but he said, whenever I drink alcohol, I put coconut water in it to calm down the pitta.
Okay. That's another thing you recommend, right? Coconut water to...
Coconut water is very cooling, but alcohol is very heating. So pitta is... So I won't recommend alcohol at all in this case.
So just to clarify, you're saying you kind of start with these kind of list of foods you mentioned, and you stick on it until you're kind of feeling better, and you do it along with the herb protocol, and then eventually you get off the diet, but still avoid milk, butter, and cheese. So for example, let's say somebody gets better and is doing better, and they want to kind of expand their diet from the simple one. Like, would they be, for example, they could eat like some spaghetti, like, or a sandwich, or like that would be fine, or like grains would be fine, like eating rice or chapati or all that stuff.
Everything will be fine. They can take sandwich, but avoid cheese in that. So
what about chips and like all the dead food you mentioned, chips and processed food and all that stuff?
No, that should not be consumed by even by the healthy person.
Right. Okay.
So I'm not recommending that to anybody.
Okay. So they should still stick to, like, they need to get processed food out. So it really should be milk, butter, and cheese and processed food. Really, it should not enter in the equation ever again.
But that food is not particularly for these patients. They can, but I am not in favor of that. Even for a healthy person, it is not good at all. So you should avoid.
Right.
Everybody should avoid.
Okay.
And there are certain things like bale. Bale is another fruit which is very good. Bale giri powder I am using. Giri means the seed, the inner seed of the bale fruit. And also mango. Mango should not be consumed for some time because mango is a laxative and also increases pitta. So mango shake or mango lassi, that is really bad for these patients.
Interesting.
Mango seed powder is very good because mango seed powder is astringent and wound healer, and that is okay. And the bale seed powder.
Okay. So, does yoga and meditation enter into your prescription as well? And what is your opinion regarding how Westerners do yoga?
Westerners, they are doing just Hatha Yoga. Hatha Yoga is just the one part, asana part. Asana is only physical postures, aerobics and exercises and some postures. That asana. But yoga is a very big thing. Yama, niyama, pranayama, asana, pratyahar, dharana, dhyana, samadhi. These eight parts of yoga are there. In one part is this aerobic exercise or the physical exercise. First of all is yama. Yama means the discipline, self-discipline. Niyama is self-discipline. Yama is social discipline. And then there is a pranayama is doing breathing exercises, getting rid of negativity or the carbon dioxide from your body, bringing in more oxygen and positive vibes in your body. That is pranayama. Yama, niyama, pranayama, and then there is asana. Asana is the physical aspect of this physical fitness, what is being followed in Western world. And pratyahar. Pratyahar is just giving up. Dharana is just focusing on one particular mission or one particular thing. Mainly, yoga means union of our soul with Supreme Soul. So just focusing on Supreme Soul. Dhyan is just sitting and staying more focused. And Dharana is just determining about the Supreme Soul. Dhyan is just sitting in one posture and focus on particular God. And then Samadhi, involve yourself and meditate and get yourself involved in the whole process of meditation. Meditation is wonderful. It immediately relieves your stress. Once you do meditation, immediately the sympathetic and parasympathetic nervous system, they are balanced. We call Ingla Pingla Nadi is there. The sympathetic nervous system and parasympathetic nervous system is there along with the spine, and they are connected with the brain, our thoughts. And when we are in the samadhi phase or we are in meditation, we see a lot of positive hormones coming from our pituitary gland or the hypothalamus.
Okay.
Or and then the positive thoughts, they balance all the vata, and obviously vata is main culprit for all diseases. And when vata is down, all the hormonal disorders, they are balanced. So the power of meditation.
So you do recommend yoga and meditation for people with IBD?
To everybody, not only to IBD.
Okay.
Recommend it for all.
Okay. So I'm just going to ask a few more questions. I know we're pressed on time a little bit. If you would kindly just stick with me, because I still want to get to the questions of the people, many people online who submitted them for you. But just a couple of my questions, if it's okay. What is your? I mean, you've said on your videos that you pretty much have like an 80 to 90% cure rate for inflammatory bowel disease in your experience. Which, to be honest, given like the data that I've seen for our outcomes, that, I mean, we have certain medications that may have a similar response rate, like cyclosporin in the setting of severe ulcerative colitis, maybe have like an 80% response rate, or generally when we use steroids, similar response rate. But long term, we're nowhere close to those numbers. So automatically, I'm going to be skeptical if that's actually true, if that would be reproduced in a clinical trial. But when you say cure, and earlier in the podcast you mentioned, so are these patients of yours that you've seen that you treat with this protocol, they get better, and are you just basing that on their symptoms, or are most of these people actually getting a colonoscopy afterwards and proving that they've healed their colon? Because people symptoms don't correlate always with endoscopic activity, and it's really the endoscopic inflammation, if that continues unchecked, can be a problem in the future as far as leading to complications. So this concept of cure, again, in your experience with this 80 to 90% rate, is it mostly patients symptomatically getting better and then they're just saying they're fine? Or is this more like long-term follow-up and colonoscopies and healed colons on colonoscopies?
It is long-term follow-up, and the colonoscopy says normal study after the protocol and after everything. First colonoscopy says this ulcerative colitis grade 4, grade 3, and the final colonoscopy says normal studies. But I have not maintain a record for research, but I invite everybody, like people, gastroenterologists like you and other big doctors who are into research. They are most welcome. They can come and they can do their research. I have all the resources. They can just take the notes, and it will be very good for this is what I'm saying, for everybody, for all the people in the world. It will be useful to have such a new, and I am all my protocols, they are open. I have not kept anything hidden. It is all everything is there mentioned in Ayurveda. Whatever is mentioned in Ayurveda, I have mentioned at my websites, and I have used only Ayurvedic herbs.
Well, one thing I want to ask about that is I've actually consulted with another Ayurvedic doctor years ago about this and what his prescription would be. And is it your experience that different Ayurvedic doctors have different prescriptions, or they all have a standard one for IBD? Because I can tell you just briefly, I actually looked back to my records to see what he was recommending. And just to briefly go over it, this was his prescription. It was Moti Pisti, Shank Basam, Kapardak Basam, Mukta Shukti Basam. He said to make a preparation of all of those. And then some other things he was talking about are Udra Amrit Vat, Bale Kuran, Sarv Kalpkwat. Yeah, that was pretty much his prescription, and then taking it certain times of the day with like honey and things like that. So that doesn't seem like it's similar to what, I didn't really memorize the particular herbs that you mentioned, but based on what I just said, does that prescription make sense to you, or because it's different from what you said?
It is different. That doesn't make sense to me, because what I have observed, Ayurveda is a very big science. It is not like only one salt for one disease or one symptom or one particular, because there are thousands of herbs, thousands of combinations, thousands of these minerals and even metals. So many things are, and even without minerals or without herbs, even with the counseling. So according to Prakriti, everything changes. So every doctor has different clinical acumen, and every doctor has different protocol. So Ayurvedic protocol can vary a lot with different doctors.
Okay.
So it can be entirely different. So it is not only one Asacol is there for IBD, or only steroids. Only in allopathic system, only if you change the doctor, nothing changes. But in Ayurveda, if you change the doctor, everything changes. So it is patient has to be lucky enough to have a correct Ayurvedic diagnosis and a correct Ayurvedic doctor who can sort out his problem. Every person is different, every patient is different, and every Ayurvedic doctor is also different. But Ayurveda is not wrong. Doctor can be wrong, prescription can be wrong. Ayurveda, the material is there in Ayurveda. So in this prescription, there Sarvkalp Kvat is a combination of herbs.
Okay.
So it maybe there are 10 herbs which may be heating to the body. Some Ayurvedic doctors, they recommend Chitrakadi Vati. They treat IBD as Sangrahini only. Sangrahini can be of different types. Many Ayurvedic doctors I have seen, they make the mistake. I have given lecture in many conferences to many Ayurvedic doctors also. Don't ever use Chitrakadi Vati or Sanjeevani Vati in your IBD patient or colitis patient, because it can, in Ayurvedic books, it is mentioned Sangrahini treatment. They correlate Sangrahini with the IBD, and Sangrahini treatment is entirely different than the IBD or colitis treatment. So they always do such mistakes. They recommend Chitrakadi Vati, they recommend Sanjeevani Vati. That is the treatment for IBS. So they correlate Sanjeevani with IBS, and they treat IBS considering it IBD or considering it ulcerative. It is entirely different. IBS is entirely, in IBS, Sanjeevani Vati is recommended. Chitrakadi Vati, the Sarvkalpkwati can also be given in IBS. So they are heating in nature, and they can even aggravate the problem.
Okay.
So many Ayurvedic doctors, they recommend this milk products. Sometimes they recommend takra is some. They recommend matha. They recommend lassi. So lassi can be very heavy for digestive system.
Okay.
So every individual is different. So every Ayurvedic prescription is different.
Okay.
So this is what I experienced, that certain norms should be followed for different patients according to Prakriti.
I just want to mention, I do disagree that all allopathic doctors treat IBD the same way. There are subtle differences. One thing that differentiates me is I do believe in dietary changes in addition to medication. And now, we have tons of medications that have been approved. A lot of them I think are very difficult to obtain in India. A lot of these, infusions, injections, just from my experience doing some talking to patients out there, is that some of these medications, these newer ones like Entyvio or Stelara or Xeljanz are pretty much very difficult to get over there. I think still possible, but very expensive. So I think there's more medical options in the U.S. compared to what's easily available, especially with the insurance situation with a lot of people in India. But just as a caveat. So thank you for sticking with me. Is it okay if I ask you the questions from the viewers now?
Yeah, I have something more to add.
Yeah, sure.
There is sometimes ulcerative colitis patients, when they are getting Ayurvedic treatment, they are getting healed. And then they, in the middle of the process, suppose they get some throat infection or some fever because of some viral infection. And then they take some antibiotics. And then again, the flare-up starts. So suppose they take amoxicillin, suppose they take this azithromycin or cefixime, these antibiotics they take for some infections.
Sure.
And then the problem starts again. But what I suggest to all those patients, I recommend them this antiviral, antibacterial herbs like curcuma is there, turmeric is there, this tulsi is there. So whenever somebody is having flu or fever or some upper respiratory infection or even the urinary tract infections, certain Ayurvedic herbs are there which can immediately treat these infections.
Yeah.
Even the dental infections can be cured by these herbs.
So my comment on that is, as far as antibiotic use, absolutely there's an overuse of antibiotics. And I think in India it may be even more overused, just based on the fact that a lot of them can be purchased over the counter there. At least here there's you have to have a prescription to get it. But I think there's a lot of overuse, worldwide, even in the US, but maybe more so in countries where you don't require a prescription for it. But yeah, that can cause problems. It can predispose you to an infection called Clostridium difficile and can flare colitis, and you have to deal with kind of both of them. But there was one study that I can remember published by the group at University of Chicago looking at antibiotic use for other conditions besides IBD and to see if it flared IBD, and they didn't see an association with flares. Antibiotics potentially can cause diarrhea, particularly azithromycin is a typical culprit that can cause antibiotic-associated diarrhea, which can mimic symptoms of IBD. So those are just my 2 cents about antibiotics. But I'm definitely, avoid them if you can. Only use them if you really have to.
But there is this herb called kutaj, which I mentioned. This kutaj is very good for all kind of intestinal infections.
Okay.
So you can try it if somebody is having diarrhea or dysentery, or whenever you are using ornidazole or metronidazole, you can use this kutaj, this herb. The tablet is available. You will see instant results like ornidazole.
Okay. Just to mention about herbs, conventional doctors in allopathic or Western medicine, we have a reservation about herbs because all of the medications that we use are, at least in the U.S., are very tightly regulated by the FDA. So patients, when they take it, they can be 100% sure that what has been advertised is actually in the pill or the infusion. They can be pretty damn confident about that. But when it comes to herbs, and I can just speak from the perspective of this country, there is no such regulation. And there's been a lot of studies on the herbs to actually confirm the components that are in the herbal preparations to see if what is advertised is actually in the pills. And a lot of time that it's not actually what they say it's in it. So that's one concern. The other concern is that the potential for toxicity from herbs, either causing drug-induced liver injury, which has been described for many herbs, not convincingly proved. I actually did a literature search before this podcast about particularly Ayurvedic herbs. I saw a couple case reports about specific ones, but not like definitive proof, which is hard to do. And also like heavy metal contaminants and things like that in these herbal preparations. So I know you do have a company, right, that produces these herbs or herbal combinations. So how can people who are ordering these things be confident that what has been advertised is actually in it and like the purity of the components and things like that?
This is a very good question, a very important one. First of all, when I made these products, it is something like when some guest come in your house and you make some food for the guest, and you will try to make it best. That is the ideology behind preparation of this formulation.
Okay.
The same formulation I am using for myself, for my children, for not only for example, maybe like right now I hear Amalaki Rasayan, this preparation I am having in my hand. It was lying just near me. I'm using this Amalaki Rasayan capsules for myself. It's for my daughter also. Amla is good vitamin source, natural.
Okay.
So all these herbs I have registered in Canada and in Europe. In America, we don't. FDA doesn't require to register these herbs, but in Canada, you need to register them. There is particular fee. The Canadian health authorities, they charge around $3,000 for one product, and in Europe also they charge little money. In some countries it is €100, in some countries €200, in some countries €500. So I have registered in different countries in Europe every single product, and all those products, they are sold legally over the shelves. By legal means they are exported from India legally, and they are imported into Europe and Canada legally, and also in USA they can be imported legally. And all the tests we do in India also for heavy metals, for all the contaminants, before sending the shipment to Europe and to elsewhere. And there also, when you register the products, the products are tested for this. You are right also, because I have, in my experience in the past, I have seen many companies using steroids, especially from Mexico. I had an experience with some doctor. There was a doctor in New York who was using my products, and he bought the similar products from Mexico, and then he got them tested for steroids. Okay. And there were steroids in curcumin. He was buying curcuma and for joint pains. So he was saying, your curcumin is not so effective, not giving instant results. The Mexican suppliers, curcumin is giving instant results. And my product sales were not so good. His product sales were very good. So I said, I don't know. I'm using 95% curcuma. What else I can do? It is the best results. I never thought of that on those lines, that to put some steroids also. But right. I came from that doctor, that guy from Mexico, he was putting some steroids to get instant results. So that is no need, actually. Mm-hmm. In my opinion, there is no need to add steroids or anything. There are so many patients, so many allopathic doctors there. They can use steroids. You are a doctor. For example, you are a doctor. If some patient come to you with inflammation, you can recommend steroid. Why do I need to recommend or give steroid in some hidden form? That is not long lasting.
Mm-hmm. Right.
And even with steroid, you cannot cure any disease. You can just get temporary results. But it is very difficult to go after the root using steroids.
Sure, I agree.
So mostly I believe in getting rid of the problem from the root. This is my philosophy. This is what I think about.
Okay. You mentioned curcumin, right? Or turmeric, curcumin. What is your opinion about using that in ulcerative colitis? Because we have data in evidence-based medicine. We have randomized control trial data that when you add curcumin to mesalamine, it works better than mesalamine alone. So sometimes I do that in my practice. If somebody's not responding to mesalamine, I'll add curcumin 3 grams a day along with it to see if they may get some additional effect. And what is your opinion about that?
Curcumin has become very popular. It is one of the Ayurvedic herbs. It is very potent anti-inflammatory, anti-infective, antibiotic, natural antibiotic, antiseptic. So whenever there is some infection in the digestive tract, digestive system, the curcumin can take care of it. It works like natural antibiotic also. And curcumin is very widely tried and tested, and a lot of research is done on curcumin on anti-inflammatory properties. So many gastroenterologists all over the world now they are using curcumin along with the mesalamine. So that is okay. My opinion is I'm also positive on it. But if somebody is having too much of pitta prakriti, then curcuma can cause heating in that person. So we have to take care that curcuma is just like natural antibiotic, but it is not having that many side effects like modern painkillers. It can be used as a painkiller also, like NSAID. Curcuma is having wonderful properties like NSAID, like steroid, like natural antibiotic. So curcuma can be given that.
What about boswellia or frankincense is the English word for that, or what about that? Because there is some kind of older data, like from the 90s, about it being potentially as good as sulfasalazine for ulcerative colitis. What do you think about boswellia?
I have a product called Boswellia curcumin.
Okay.
So I'm using in my practice Boswellia curcumin. A lot of Boswellia curcumin I'm using. Boswellia is healing of the wounds. It is powerful anti-inflammatory, and I'm using frankincense in all the patients. Not only ulcerative colitis, but also arthritis patients. Boswellia curcumin is also very good in all kind of inflammations. Whenever there and infections, some sore throat is there, pain is there, some spondylitis is there.
Is that something that, because you didn't mention that in your initial, in the herbs you initially mentioned, is that something you give to everybody, or is that more like an add-on thing if they're not responding?
It is like an add-on thing when they are not responding. For example, if I doubt some complication like some, for example, some anal fistula is there or some abscess is there. So it is like antibiotic I use. If I need to use some antibiotic in colitis patients, so I use curcuma and Boswellia curcumin. And there is one more interesting thing about this Boswellia and curcumin. It is like gold. When you use gold, you take 12 karat, 14 karat, 18 karat, 22 karat. You have to prepare it. Similarly, curcuma also you have to prepare it. So I'm using curcumin 95% extract is what I am using, what I recommend. So some people they can put in 65%. Some people they can put in the capsule only 40%. So that also makes a lot of difference.
Sure.
To cut cost, many manufacturers they use only 40% curcumin. Nobody knows what is there in the capsule. So it is very important for the manufacturer to be good to his own consciousness.
Right. And what about using black pepper? I've heard that black pepper enhances the absorption of it. Otherwise, you don't absorb much. I guess in the setting of colitis, you don't really care if it's absorbed. Really, you're trying to get it to the colon anyway. But do you use black pepper with it at all?
No, I don't recommend. It has become a trend. Like maybe modern researchers, they have found that it is bioavailability of curcumin is more if used with black pepper. According to Ayurvedic principles, curcumin alone is sufficient, good enough. So I'm using curcumin and black pepper. They almost have similar properties. So black pepper is not needed to curcumin to get into the blood. This is what, according to Ayurvedic principles, not according to modern principles. So I use plain. I have another product with black pepper also because people in USA, they were asking for it. But in my personal practice, I'm using curcumin only.
Okay. A very common question I received from people was there's this diet. There's another diet, you may have heard of it. It's called a specific carbohydrate diet. It has certain elements that are similar to your diet, but other ones that are completely opposite to it. There's a lot of people who've had success with it. Not everybody, but there's been a significant proportion of people who have gotten at least a symptomatic response. And there is some weak evidence published in our literature that it may help decrease inflammation as far as case reports showing healing of the colon. So, and it's people are asking because every single, like a lot of the foods that are allowed on the SCD are completely opposite of what you said. Like, for example, the starter diet on the specific carbohydrate diet includes cheese, a form of cheese called dry curd cottage cheese. And there are other foods in it that are also thought to be heating in nature. But I think cheese would be a main one. So they're just trying to see, because like in Ayurveda, you're trying to eat more of these cooling foods, but there are people who eat foods that are considered to not be that and are still getting better. But the common denominator seems to be processed food. Like getting rid of processed food is very common to all of these dietary protocols that are helpful for Crohn's and colitis. So they just wanted you to comment on that, and what are your thoughts about people who get better on different diets that are kind of opposite of what you're saying?
This my protocol is which I have explained you is in general for general population and my experience. But what Ayurveda says, according to Ayurvedic principles, that every individual is different, every person has different prakriti, and every food item has different constitution or different prakriti. So if somebody is too much vata or pitta person in prakriti, he is consuming cheese, then it can cause a problem. If somebody is kapha, he consumes little bit of cheese, no problem. So similarly, it can vary. But in my experience, what I have observed, that cheese is not good for in the long run. It can give temporary relief sometimes, but in my experience, I have seen in the long run it is not useful. But maybe for some kapha person it may be suitable, so he might have got results with that also. Okay. So, but according to Ayurvedic principle, one should analyze the prakriti first of the patient. It is very important to analyze the prakriti.
And how is that done? How do you analyze someone's prakriti, if I'm pronouncing that correctly? Is that
prakriti?
Yeah, go ahead.
Prakriti is nature in English, so you can use the word nature also. Okay. Every individual has different nature, and it all depends upon basic constitution of the elements in that particular person. Okay. So for example, I told you we are made up of 5 elements. If person is having more air element, and if person is having more air and space element, he is having more vata prakriti. If person is having more fire element in his body, he is having pitta prakriti. If person is having earth and water in his body, he is having kapha prakriti. So we can analyze the prakriti just by looking at the person, just by touching the person, just by feeling the pulse of the person, and asking some certain questions. Because prakriti, we can depict even with the experience, we can just see and you can tell the prakriti of the person. So I usually see the person, I can even hear the sound of the person, and I can tell the prakriti of the person.
Okay. Another question I got is any specific treatments for fistulas, perianal fistulas? I think you mentioned sometimes you use curcumin, boswellia for that, but what are your thoughts on fistulas?
In fistula, I use Ayurvedic antibiotics. For example, this curcumin, neem capsule I'm using, boswellia and curcumin I'm using. Gugul is another powerful antibiotic I'm using. Trifla Gugul is there, which is and I am also using some healing oils. this Nirgundi oil and Jatyadi oil, jasmine oil made from Jatyadi is made from jasmine oil. Nirgundi is another herb called Vitex nigundo. So these base of the oil is sesame oil. So the recipe can be found over internet. These oils, I can give enema of these oils also because they are powerful antibiotics, anti-infective. And if they are not healed, usually fistulas, they are healed within 3 months, 3 to 4 months or 6 months with these protocols. But if they are not healed, we have in Ayurveda, there is a very good Shar Sutra therapy. That is surgical procedure mentioned in ancient Ayurvedic text called Sushruta Samhita. Sushruta is ancient Ayurvedic surgeon, also called father of surgery in modern medicine. We have heard, we have read. Father of surgery is Sushrut. So Sushrut was used to do this Shar Sutra therapy. In this, a thread is passed into the fistula and then tied up on anal canal.
Okay.
Outside, and tied, and slowly it cuts through the fistula. Slowly. In modern surgery, you just make a cut once, immediately, one go. But in Ayurvedic, this Shar Sutra, we just put in the thread, which is a medicated thread, like a suture, made from the various herbs also, which are totally sterilized. And then we tie up that suture, and slowly it cuts through the fistula, and then the back of it heals, front of it cuts, and slowly, every 3 days, 5 days, 1 week, we tie up again and tighten the knot, and it heals the fistula completely. And there is no recurrence. So it is a very good Ayurvedic procedure. You can read about it. It is called Shar Sutra therapy. Shar Sutra therapy for anal fistulas.
Okay, that's a notoriously difficult problem for us to treat. On my side of it, in Western medicine, there is the. Sorry, say that again.
You are also doing surgery?
That would be more in the domain of colorectal surgeons, but we usually treat that with biologic medicines, what you mentioned, like Humira, Remicade, along with immunomodulators, because that tends to be when you have fistulas, it's a poor prognostic sign for Crohn's disease, so we're pretty aggressive with medical therapy. So it tends to be a combination of medicines and a surgical approach is similar to what you're describing. Most of the time we put aceton in, which is what you're describing, just this kind of rubber band through the fistula. Surgeons nowadays, in my experience, don't use these cutting setons as much because there's a risk of developing incontinence if you cut through too much of the anal sphincter. So most of the time they're just putting these non-cutting setons, and then we treat with the medicines for the fistula, and eventually these setons hopefully are removed. But the healing rate and the long-term outcomes are not that great with that approach, and a lot of the time there's recurrences. So, but that's fistulas when they go with Crohn's. But fistulas by themselves, without Crohn's, just cryptoglandular fistulas have a better response rate to the type of intervention you're describing.
Okay.
And the fact that you're using antibiotic or potentially like these herbal antibiotic preparations for fistulas, we also use traditional antibiotics, and those do help with decreasing pain and drainage from them, but they don't tend to heal fistulas in our experience. Healing fistulas more requires this kind of combination medical surgical approach to getting that done.
I agree with that, because sometimes they can be healed, but most of the times you need surgical approach also.
Okay. Do you have any different protocol for children? Somebody had asked about particularly very young patients with Crohn's and colitis. Does your protocol change at all, or is it pretty much the same for kids too?
It is pretty much the same. Only the dosage of the herbs that is less. Everything else is the same.
Okay. So thank you for sticking with me. I know I said this would be an hour, but you've kindly stuck with the interview. Now we're almost at 2 hours now, so it's a lot of great information, and patients can take what they feel is valuable to them. Some people did ask, like, where do people go from here? I mean, they listen to your protocol. If they want more information or want to reach out to you, what is your contact information? What is your website? What's the best place to go for them to find your information?
I have a website, planetayurveda.com.
Okay.
So I wanted Ayurveda to be all over the planet. So I named it planetayurveda.com. And patients, they can go to the website, and they can even WhatsApp, send queries through WhatsApp. I have a helpline. I have doctors, Ayurvedic doctors under me, and I have given them mobile phones. So at the website, WhatsApp support is there. They can WhatsApp their reports and their clinical history, and then we can get back to them. And meanwhile, they can see my videos and follow the diet plan. And this way, they can contact me.
Okay, great. Thank you so much. Any last words for us? Otherwise, again, appreciate your time. Thanks for coming on. And my hope is with this conversation that, as you said, I'm one of these physicians who's open-minded to doing research and testing out these things, because I don't think we have good treatments, medical treatments and surgery and things that have been shown to be effective in very high-quality evidence-based medicine,
yes.
high-quality trials. We should not just outright dismiss other approaches, especially if people feel like they're having success. It's not impossible that somebody will come across something that actually works. And I think it would be unfortunate. So I am an evidence-based person. I have not come to any conclusion based on this conversation itself, but I'm open-minded, and I hope that one day that this will be rigorously tested in the appropriate fashion, so we can see if this actually works or not. But I'm glad this information is out there. I hope this opens people's eyes to an approach to IBD. I definitely think in the West is not being recognized, and a lot of people have no idea that this is going on. But it's a common thing. I've spoken to multiple people in India who've reached out to me through this podcast who have tried Ayurveda. Some have had success, some have not. Some have had partial success and have had to use medications along with it. So that's just been my experience talking to people. But I think it definitely needs to be investigated just by the fact that so many people are trying it, and we need to get to the bottom of if it's as effective as you say.
Yes, I am glad that I have met you, and you are an open-minded person, and especially such a well-placed gastroenterologist, and you have such a good open view for this ancient science. And I expect a similar thing from so many more researchers who are into allopathic, who are working into allopathic medicine. Mm-hmm. And they can do the research according to their own parameters, like make it evidence-based. So then only Ayurveda will flourish. We are trying our best. We are not too many in numbers. But modern doctors, they have resources, they have research labs, so many things are there. And they can compare with their these equipments, whatever they want to do. It is if they open up their mind, then only they will be able to verify it. Otherwise, how they will identify?
I guess one of the problems, and just to briefly close with this, one of the problems is your protocol calls for like a multimodal intervention, right? It's diet, it's herbs, it's lifestyle, it's a lot of things. And to create a properly conducted trial, you need a control, right? And you need another arm of, because there is one study I found on Ayurveda and ulcerative colitis, but and I'll talk about that in the introduction, but it was a case series. It was like a series of patients that ultimately did well with this Ayurvedic intervention. But if you can only do a high quality trial if you're like doing like one element at a time. So it's like one herb at a time. But when you use like these combinations of herbs. You have to have a placebo or kind of a comparable treatment for each intervention you do. So you'll have to have a placebo diet, a placebo herbal preparation for each kind you use, a placebo behavioral intervention. And that's expensive to do. Nobody's paying for these studies. So that's why pharmaceutical companies have kind of like a dominance over the Western and evidence-based medicine, because they put up the money to do the research, and their research is easy to do because it's just one thing. Give somebody a pill or give somebody an infusion, and easily. And even those studies are difficult to do and are expensive. So you can imagine how difficult it would be to actually study your protocol. It's not impossible. There's been similar things that have been done. I would reference people to Dean Ornish's study using a very low-fat diet as well as stress reduction, smoking cessation, like this kind of combined protocol for heart disease. And he did show that heart disease was reversible or somewhat reversible using those interventions. But again, he had to lock people in like a hotel and had to, people couldn't go home. Like, it was a very, very controlled setting. So to do that's expensive, requires a lot of money and a lot of motivation behind it. Yes. So that's the limitation. And that's unfortunately why in inflammatory bowel disease that the highest quality evidence comes always behind medicine. And because it's just the easiest thing to study and the most money is backing it.
Yeah, you are right. It is now it is very important to do this research and do this study. Basically, I am a physician and not a research person. You need a lot of resources to do the research. As you mentioned, that you need a lot of money and you have to lock in people for some time, hospital kind of setup.
Right.
So I have the patients who come to me, approach me, follow the diet and follow the treatment, and they become all right, and that's it. Whatever I can do, I can just keep the records. This is what I can do at my end. And placebo. Moreover, we are physicians. For example, if somebody come to me to see me as a patient, how can I just give him a placebo and just send him back? That is practically, for me, it is not possible. Just give him nothing, right, and tell him just you go back. And and what he will do, he has come to me for his problem, sure, not for the research one. So I have to solve his problem. So it is a kind of work which should be done in some research facility, sure, not in a clinical. Cannot be possible in a clinical setting.
Right.
So the control trials are possible, but they need a lot of resources. Maybe in future, if I set up something for research, then I will do it. Mm-hmm. Meanwhile, I'm keeping the data. Meanwhile, I'm keeping the patients. I have so many patients who are now in touch with me, and I have the data with me. So I will, maybe in future, I will do the research also. I publish it as a evidence-based also.
So one thing that I would suggest for you, and this isn't research, but it may be the best you can do as far as convincing people, is, I know you have a very popular YouTube channel. A suggestion I would have is that if you have patients who are agreeable to actually be monitored through the process, not retrospectively, but you get a patient that's willing to go through the treatment. You actually have the colonoscopy report from when they see you. Then you put them through the protocol, the treatments, assuming they get better, you have them get scoped again, and then you look at the report again. And you do that all on camera. I mean, that would be such a convincing thing, especially if you have multiple people like that. I'm
already doing it, but not on camera.
Yeah, that's the thing. I think seeing really is believing, especially for people listening at home, and to actually see that happen in a prospective fashion. Because I know you have videos of patients who've said yeah, I did this, I got better, but actually and again, I don't know if confidentiality as far as medical records, if people actually want that out, but I think some people don't mind and sharing their story. So to actually see that would be, a picture is worth 1,000 words, and it's very convincing. And again, that doesn't constitute as evidence, just a few cases, but still, it's better than nothing, I think.
Yes, you are right. I will do that. I will try to do. whatever possible. I have not only ulcerative colitis patients to deal with. I have a more interesting in the sense, not interesting, but complicated, like ITP.
Right.
ITP is a very bad disease.
Hmm.
So accidentally I found, I would say, a cure.
Really? Okay.
Accidentally, by chance, I used certain combinations which were mentioned in Ayurvedic text
Okay.
for that disease is called Rakta Pitta in Ayurveda. So
Uh,
I gave some combinations for that Rakta Pitta disease, and the patient got cured. So in that case, I can use cured word because it is easy to monitor. You have just check the blood count, just
uh-huh.
check the platelet count, nothing else. So just you check the blood report. In first blood report, patient says 1,000 platelet or 5,000 platelet count,
Right.
and in after the treatment, the patient says 200,000, 300,000.
Hmm. Hmm.
So that is another very interesting topic which I am working on,
Okay.
and I'm getting very good results in that also, and many other problems. So
Interesting.
research work is something different, clinical work is different.
Sure. No, but I appreciate what you're doing. I think, this will be an ongoing conversation, and we'll see what happens. I think people are already trying this and reporting on their experiences. So I'm optimistic. I hope you're right. I hope you're right that this is another option, another tool in our armamentarium to deal with these diseases, because they're devastating for some
Yeah.
people, and and for there to be some hope of other approaches, especially for people who that don't do well with conventional treatments. It is something that definitely at the very least needs to be researched. So, okay. Thank you, Dr. Chauhan, again for your time. And maybe in the future we can have you on again, if you'd agreeable.
Yeah, I will agree, and I would like to share more information on Ayurveda on your channel.
Okay. Yeah, let me know if you have any new insights or anything, and we'll definitely have you on to share that with us.
Okay, thank you very
All right.
much.
Thank you so much.